am so excited to hear about your trip to Haiti. And so if you can just tell us a little bit about it, it sounds so interesting as a community engagement project.
Well, Reva, let me just tell you that you would be pretty proud of our students here at Stockton because it really was an inception and a seminal idea that actually came from the students. So I had two physical therapy students that decided to visit me in my office back in the spring in March, and they said, Dr. Galantino, we'd like to embark on a pro bono international clinical experience.
Now that is something.
So the fact, number one, that we teach in our curriculum citizenship and pro bono really got manifested from their desire to go internationally and serve.
So what were the name of the students?
So it was Sarah Pitcher
All right.
and Emily Bessemer. And both of those students approached me and I looked at them and said, let's make it happen. So I charged them to explore what was actually available in global internships from the American Physical Therapy Association.
All right.
And similarly, I live in Wilmington, Delaware, and we have a group called Haiti Family Initiative. And this Haiti Family Initiative actually has been going on. It's the fourth year since the inception of the earthquake. And
Okay.
Haiti Family Initiative is an organization that has been committed to serving children and families. We were with Global Therapies, which the students found specifically, and we made contact with Global Therapies Group, which was started by a physical therapist and then has been continued over the course of these last 4 years since the earthquake. It's really interesting because there's a number of NGOs that have gone to Haiti, have had service, and then especially...
So let me interrupt you for
Please.
just a minute. What
Please.
are Global Therapies?
So Global Therapies Group is an organization that both Sarah and Emily found on the website at the APTA level, American Physical Therapy Association, and they made the contact with the co-founders. Donna Hutchinson responded to us as a physical therapist and was thrilled because the only way the clinic operates is purely volunteer.
That is great.
The key feature, though, is that in order to have students there, we have to have a licensed physical therapist. So
Okay.
whether it would be myself as a faculty member or an existing licensed physical therapist, it clearly was the opportunity for me to go down and assess an actual international clinical experience for future students as well. So it served as a dual purpose. Number one, we have our Global 2020, which the Global Initiatives is a real focus, and the office that India Karavakis oversees
Yes.
really helped to also support a proposal of this kind to go and actually assess the feasibility and the sustainability of such a clinic for our graduate physical therapy students. Not just physical therapy students, though, and I want to make a clear point about that because one of the area of interest within the School of Health Sciences is interprofessional education.
Okay.
And interprofessional practice really gets played out when we are teaching with other disciplines.
Okay.
So fortuitously, we had in our clinic the first week with Global Therapies Group, we had physical therapy, we had a speech therapist, and then we also had an occupational therapist.
Now, did they all come from Stockton?
No. They
All
were
right.
all, which even made it even more diverse
Yes.
and more creative, because what happens is that we're now bringing a team together that are from diverse backgrounds, diverse years of a clinical experience, and then diverse parts of the world.
So in other words, Stockton was part of an international team.
And the clinic is breaking ground actually for a new site. So this is rehabilitation in Haiti is interestingly underrepresented because it's really a new concept. They do have a rehabilitation technician program that does assist individuals in getting a 9-month certificate in rehabilitation technician skill set.
Okay.
But there are no physical therapy nor occupational therapy programs, nor speech therapy programs that train the Haitian people in the skill set of rehabilitation techniques.
So tell me, what did you learn from your trip to Haiti that you can bring back to Stockton and help us in community engagement?
Well, first of all, I would say the gift of watching our students shine in a very different place, space, and language has you see the resilience of our students. That's number one. Number two, the art of cultural immersion creates the opportunity to see really what are you made of. What are you able to do in the face of, in Sarah's case, Sarah had never seen or hasn't been exposed yet to the neurological population.
Okay.
She had just come off of an orthopedic rotation, had no problem stepping into any type of orthopedic population. So the good news is that she was able to be exposed with me as a facilitator in the area of pediatric developmental disabilities. And in Haiti, we have a large population of men and women and children that have strokes due to very high blood pressure that is not controlled due to the lack of access to medication. So our patient population was diverse enough for our second year physical therapy students to have enough clinical expertise to step in, but yet also have an abundance of learning which they will go into this final year and already have the skill set from a practical application standpoint. So it's very exciting.
So that is great for our students. What about our faculty? What lessons did you learn that faculty would be interested in? Let's say it's a faculty outside of health sciences.
But what a rich opportunity for faculty across Stockton to be able to participate in, say, the Haiti Family Initiative Week, where we really are looking at social services that are available to the community at large in various places throughout the country.
This sounds so interesting. So if a faculty member just wanted to get started and couldn't envision traveling yet internationally, what advice would you give him or her?
First of all, I would say let's sit down and talk about how best this meets both the faculty needs as well as a student need. I think a marrying of the efforts really creates a pinnacle of an experience, because I have always wanted to do a medical mission trip, Riva, always. And to have students ask to actually manifest that, it was really the art of coming together. And then the
But
added...
you're also talking about the community as well.
Absolutely.
So it's a marriage of needs, all three, the faculty member, the students, and the community. What an excellent example.
I will tell you the speeches that our translators gave us on the day of our departure brought tears to our eyes. They stood there and said, we are a culture with very little resources, but we have big hearts and we're so grateful for your being here. So I think the richness of understanding cultural immersion and understanding also the spiritual beliefs of healing.
Yes.
The whole aspect of voodooism and their spiritual underpinnings really was, how do we marry the Western way of doctoring and rehabilitating, so to speak, in concert with spiritual beliefs, was a very rich perspective. And then the art of how do we communicate to the translator exactly what we need to get back from the translator so we know how to serve the patient, or in the case of the children, being able to serve their needs as well.
Dr. Galantino, it has been fantastic speaking with you, and I could just listen to you all day. But thank you so much for sharing about your trip to Haiti, about the role that our Stockton students have played, and about how faculty and students across campus can get involved with community engagement projects such as yours.
Well, I'm grateful for the opportunity. I thank our International Office for Students and Faculty. I'm grateful to the School of Health Sciences and Bess Catherine's for helping to support our students, Jan Colleen in General Studies, who also supported Sarah's trip to Haiti, and for all of the team. It does take a village, quite frankly, here at Stockton to really put together a rich and engaging international experience. But we have all the resources here. It's just a matter of faculty and students stepping up and saying, this is a desire of mine, and we can see it come to fruition. So thank you for all your support, and thank you for the opportunity to really share this with our Stockton Center for Community Engagement. And I am just honored to be a resource to anyone who needs it.
Thank you.
Thank you. Thank you so much.